Hello everyone, I'm Urologist Ömür Erdem Akkaya. Today I am going to tell you briefly about HIV. The HIV virus was isolated in 1983. It is a sexually transmitted disease that has existed in the world from then until now and has cost many people, rich or poor, their lives and careers at a young age. Of course, it is still active in the world. In our country, about 2,000 more people were infected in 2021. You can see the HIV numbers for the last 5 years here. How is HIV different from other sexually transmitted diseases? In the past, there was no cure for HIV. Now the patient has to be treated. If the patient is not treated, you can easily say that it will cost the patient's life. HIV used to cost the lives of those infected, but today death can be prevented. With treatment, patients can continue their lives normally. What should I do to protect myself? It is absolutely necessary to protect yourself with condoms. Monogamy is very important. If you think you have had suspicious sexual intercourse, if you think there is a possibility of HIV transmission, then it is wise to go to an infectious disease clinic immediately and get treatment within the first 72 hours. It can be said that this will reduce the possibility of HIV transmission. This treatment is not carried out in every clinic, but only in university clinics. That being said, one of the most important things to know about HIV is that how HIV is not transmitted. There are many people living with HIV, there are many people who continue their careers with HIV, who continue to work in the public sector. These people, of course, do not tell even their closest relatives that they are infected with the HIV virus. This is because they think that if they tell, they will be isolated, discriminated and labeled by those around them. In this regard, the Kırmızı Association is trying to do activism. As I said, the most important thing is to know that HIV is not transmitted. How is it not transmitted? HIV is not transmitted by touching, shaking hands, salivating, tearing, biting two people by the same mosquito, living together, using the same cutlery, sharing the same room, breathing in the same room. Knowing this is also very important. The infectiousness of a person receiving HIV treatment decreases dramatically. Even if they have sexual intercourse, they may not transmit, almost zero possibility. If you have sex with someone who is not receiving treatment, the chance of vaginal transmission of HIV is about 8 or 4 in 10,000. Now you can say that this rate is very low. In reality, there is another problem. If you are infected, the probability is 100%. That is why this ratio is so important, whether it is 8 or 4 in 10,000. Finally, the most common type of transmission in our country is heterosexual. In other words, heterosexual relationships, not homosexual relationships. That's an important detail for HIV. What young people especially should know about HIV is that it can be transmitted very easily, even if the infection rate is low. That a white site can be completely contaminated. And my advice to young people is that they should not have sexual intercourse without using a condom. Monogamy, as I said, is very important. Because sometimes young people are unaware, they are careless. We are very upset when a young person is diagnosed as HIV positive. Because he will be treated all his life, he will isolate himself on many issues, maybe he will have to keep it a secret for the rest of his life. If you have a question mark in your mind, be sure to use a condom. This also applies to women. Recommend that men use condoms. These are the last things to say. Thank you for listening and best regards.